ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. Welcome back to another episode of Beyond Graduation. I'm Savanah Craig, and with me as always,
I'm Ronnetta Sartor. And so today we're going to talk about something that has been a pain point for me, being semi-new practice owner, but just in general with my personality and that sort of thing. And so Savannah and I have been talking about marketing and branding and how in dentistry now, patients want to kind of know you, know your team, and feel like you all are people that they want to build a relationship with before they schedule their appointment sometimes. And so for a person that's not really into social media or really into like putting themselves out there, or having team members that don't really want to put themselves out there, it can be interesting, branding yourself. What are your thoughts, Savannah? What extent have you had to, I guess, think about these things so far in your career?
thankfully not a ton.
It's coming, girl.
I guess in some way, like in not so much social media or website stuff, but I guess like in patient interaction, there's some of that. I think you and I laugh about like the good old days of dentistry where they just show up and they trust you and they believe you and you do the thing and hang your little sign outside and you're the only dentist for 20 miles and you just keep rolling.
Right.
But yeah, my boss just had us all read Unreasonable Hospitality. Have you read that?
It's on my list.
Okay, you should read it. It's great. But the whole idea behind it is it's talking about like the restaurant industry and like the ways that this manager and then this company like go above and beyond for their people. And I go back and forth every day on like buying into that so hardcore of like, yes, I want to like the like famous example from the book is like these people, and it's this like 3-star Michelin restaurant or blah blah blah, and these people are at the table and they're talking about how they've eaten at all of these amazing places in New York City but have not had like a street hot dog. And the culture of this team in this restaurant is like, if you overhear things like that, like going to go get them a street hot dog, or like if they're talking about a movie they love, like show up with the DVD when you hand them their check, or like just these
It's
like
like Ritz Carlton. If you
yes.
ever read any of their books on like how they train their teams, it's very similar.
Yeah, so it's like all about creating these like magical moments, and like that ends up being like the culture and the brand, because when they do these things then their team gets excited and like it keeps going. And so on some days I'm like, yes, let's do this. Let's make the dentist the best experience. Let's do this thing. And then other days I am tired and I'm like, you want your teeth fixed or no? Like, I don't care. Like, not that I don't care, but like, your mouth, your choice. Like, and so I don't know. And I'm sure like that, that's probably how you're feeling about branding, is you're like, I don't know. Do you want to come get your teeth fixed or not? But also, I need patience to run this business. So
Yeah, completely
is
understand.
that how you're feeling?
Well, I think one of the good things for us is that we have a lot of internal marketing that's happening.
Yeah.
So I don't feel as much that I have to do a lot of the like social media and, that sort of stuff, even though it's still important to do, right? But I think we've gotten to a point in our practice where we have a lot of our patients that are referring patients to us. And so it's been nice to have like existing patients that are referring their friends and family, if that makes sense. So it's been nice to have a program to like thank those patients, and every time they come in, thank them for, the patient that referred them, thanking them, but also thanking the patient to like take the step to actually take a chance to come to our office and welcome them into our family. But like I do see how, yeah, patients love to be able to like look online and like see who you are and that sort of thing. So I think the delivering wow service and excellent stuff, we that's something that we try to do internally. But I think the part that I could be better at personally is the stuff that's not inside our
The
four walls,
external.
right? The external, like making sure that like when someone Googles us, they find us, which that's a whole another conversation, like SEO and all that kind of stuff.
Listen, it is a blessing and a curse. My boss has insane marketing, and we are the first thing that pops up when you type in anything dental related. All of our offices show up, which is awesome. But that also doesn't, it's also not selective. So you can type in like and we just talked about this, like being a general dentist that does a lot of specialty procedures gets confusing. So
Mm-hmm.
people will type in like oral surgery or tooth extraction, and we come up first, and they just automatically assume
You're the
we're
specialist.
the specialist. And a handful of times a month, patients come in, and sometimes it's a thing that we can take care of, but sometimes it's a thing we can't. And then you have to be like, we are general dentists, blah blah blah. And like it's really hard for our business team because we don't want them to tell patients we can't do your extraction, because honestly we don't know until you get in here and we see the x-rays and we understand everything. And there are times where their general dentist has sent them to an oral surgeon and we can do the thing, and then they end up staying because they like that we offer everything we can in-house. But then you have the one-off patients who do need an oral surgeon and they find out we are not an oral surgeon, and now they're frustrated because they came here for an exam that seems a waste of time.
Yeah, I think
So
that's
SEOs are
tough.
good and bad.
Yeah, it's tough. Yeah, it is really good. It's good because it can make sure that you're at the top of the list, but
But
it can be frustrating for patients to like to kind of know, who's doing what and who's
yeah.
a specialist and who isn't.
Or we've had a couple of times where, and I also think part of this is like media literacy and internet literacy in older generations. So you can Google like blah, 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 whatever, and Google these days, the top like 5 things are sponsored, and they might not actually have anything to do with what you're trying to search. And so we've had some people call our office looking for their dental office,
Oh,
and they're like, is this blah blah blah? And we're like, no. I don't know, it always makes me think of SpongeBob, where they're like, blah, and they're like, no, it's Patrick. That's us. And they're like, but I googled and this number came up, and we're like, yes, but you didn't click on the right office, and you just called the first number you saw, and that's us, and we're not your office.
but we can be.
Right. Right.
But we can be.
Right.
Let's talk more about that. What
Yeah.
do you need done?
Yes. So again, can be good, can be bad.
Yeah. The good part is they called you.
Correct.
So it's working from that perspective.
Yeah, it's all about perspective. But then sometimes people get mad and confused, and you're like, especially not especially, but like sometimes they're calling because they have a post-op complication from another office.
That's true. Yep, that's true.
And you need them to go back from where they came
You're
from.
like, yeah, maybe go back there first, but we'll still be here.
Yeah,
Yeah.
later if you need us.
Or if you want a second opinion,
Right.
we can be your guy and gal.
So who, or I guess from where do you feel like this pressure for branding is coming? Do you think it's just like the environment we're in? Is it somebody on your team?
No, I think
Is it just the world we live in?
I've been doing a lot of research on it, right?
Okay.
And
Okay.
so for me, it's just more so, okay, and it was, I was at a conference maybe a few weeks ago, and what the guy said was the person that markets the best wins in the
Sure.
space. And
Sure.
by that, he meant like you can be the best dentist clinically, but patients don't know that if they can't find you.
Yes.
And I guess for me, that kind of just struck home because I'm like, I'm great. Like, I'm a nice person. Like,
Yeah, yeah,
I
yeah.
love all of my patients.
Yes,
Like,
yeah.
I can't wait for them to come in for their appointments so that we could chat and catch up on what's going on.
Yeah.
But that's for the patients that are already in my four walls,
Yeah.
of the office. But
Yeah.
if I'm doing a disservice to the community by not letting people know, like, how awesome my team is and how we really just want to help them, if I'm not, kind of pushing the brand, and it's not to do it in like a bad way or anything like that,
No.
but just doing it in a way to say, hey, we're here. Hey, like you said, these are the things that we offer, we'd be happy to welcome you into our family, that sort of
Yeah.
thing. And so I do have one person on my team that's like, Doc, you need to do this, and that. You need to come in on a Friday and I'll record everything. And I'm like, okay, I don't
That's
want
so
to, but I
sweet.
will. Yeah,
Yeah.
And I think part of it is like, I'm really good, like one on one, but I'm really bashful about like talking about myself. And that's one of the things that I will say has changed in the almost 3 years that I've been a practice owner. Like, I've learned that I have to be able to like talk about myself and talk about the business in order to be able to grow.
Yeah. Pushing that comfort zone.
And so some of the things that have helped is this podcast. That's one thing. But in addition to that, like initially I joined like some business networking
Yeah.
groups in like the Chamber of Commerce in my area and that sort of thing. So just going out and meeting people in the community and just talking about it because everyone's there networking. And you'd be surprised how much you can learn from other small business owners about the community or just like what's worked for them in terms of like, if it's a magazine that everyone gets that they really like, or if there's an
Interesting.
event coming up in the community that will be really good if you showed your face and let people like know and see who you are.
Interesting. I don't know if you've talked to like Don and David at all, but like has coaching come with any of these like tips and tricks and pointers, or are most of that so far has just been like internal systems?
Well, I think coaching has helped create a lot of the internal systems, but it has also, I think, collectively as a team, like me as a doctor and a leader in the team, it's helped me to be more confident
Yeah.
in like holding everyone accountable, including myself first,
Yeah.
But I think coaching has also allowed my team to individually put on their own leadership and take responsibility for the tasks that they are assigned
Mm-hmm.
and to know it inside out and to excel at it. So I think coaching has helped from that realm for like everyone feeling like, okay, this is what I'm gonna do and this is how I'm gonna own it, and in doing so this is how together we create those systems that help boost the practice, but also let patients know like, hey, we're all on the same page, which
Yeah.
that's really nice because if I'm going to any place and one person tells me one thing and then the person at checkout tells me something different, but I heard something different on the phone, it gets
Yeah.
frustrating,
Yeah. No, I totally get that. Yeah, there are so many pieces to it, but I also think so. Would you say most of this like building the brand thing as far as like external things is mostly just like being out in your community and being present that way, or are you coming more from like a website, social media side of things, or both?
I think in today's society, it's all of the above.
Yeah,
I think you kind of have to do a little bit of everything.
to try to break through the
Um,
noise.
Right. And I do know that there are going to be some people out there that's like, hey, listen, I'm the only dentist for like 120 miles.
Yeah.
Your situation is completely different,
Yeah, 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 yeah.
But I think, to some extent, it's like all of the above. You kind of have to do all of the above.
I don't know if you have any insight on this, but like assume that marketing in an out-of-network practice looks a little bit differently than marketing in an in-network. And I've heard some like thoughts about like when you're in network, obviously you're going to have more write-offs, but like if you consider that part of like a marketing budget where like insurance is helping you market, do you have any thoughts on like how that might look from like a brand perspective and like where you got to put yourself?
Yeah, from I've heard completely different things, right? But one of the most recent things I've heard is that in dentistry in general, whether you're in network or out network, what our budget is for marketing is really low compared to a lot of other industries.
Interesting.
And so, in that, pretty much, I think in my scenario, I probably should market more, but I think I have to be more specific in my marketing, if that makes sense.
So, totally. When you say our budget for marketing is very low, do you mean, or do you know, is dentistry in general, we don't spend a ton on marketing, or we don't have as much in our budget to give to marketing because of like overhead and other things?
I think it may be a little bit of both, possibly,
always,
right?
always,
Right.
yes,
I think,
and
yeah, I think it may be a little bit of both. So I'm not going to call any names out, but think about corporate dentistry and think
sure.
about how much they market. You
Yeah.
mentioned when you go to Google and you put their name in, a lot of time they're sponsored and they're the top thing that pops up, right?
Yeah. Yeah.
Can you imagine how much more they're spending on marketing compared to me?
Right.
And so, you know,
Yeah.
I think the little guys have to figure out how to navigate that.
Yeah, how to hit a harder punch with less resources.
Right. And so my patient pool loves Facebook. So right now I'm trying to do things on Facebook. Like we get our most engagement on Facebook. But for your office, it might be that Instagram
Yeah.
or YouTube is
Yeah.
what's doing it for you, you know? So I
Mhm.
think part of it is just finding what it is that's working for your patient and your patient population and doing it as much as you can, and but also realizing that the tides change very frequently and being willing to move and pivot to whatever's next.
And that's I think the thing that makes it really hard in dentistry is think of like big corporations that have like marketing departments who can like run those report and run those numbers and like yes you can outsource to a marketing firm blah 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 but like at the end of the day I'm sure it's you running a lot of those reports and knowing that your engagement is higher on Facebook, and not only is that time but that's like mental energy that you're spending. And so I just like want to acknowledge that piece of another hat you must wear as a dentist is your
I don't know.
marketing
This
team.
is a great topic. I would love to hear what our listeners are doing. It's many new things coming out, like using AI to help generate
Oh
some of this
God.
stuff too. So whatever you guys are doing that you love, that's working and getting patients to see you, and we would love to hear it all. So definitely reach out to us and let us know.
Totally. All right. We'll catch you back next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr_Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.